So Determination was a large multi-center study in the United States. It almost mirrored the study in France, which was published in New England Journal around 3 to 4 years ago. Patients are randomized to get transplant or no transplant in the background of getting RVD-based regimen. And this study was very exciting because there was a difference between the French study, which is that the French study had 1 year of maintenance with Revlimid, and we had maintenance till progression in our study. With that difference, counter to what the expectation was that the long maintenance might decrease the importance of transplant. In fact, our results, and the reason they were very striking, reason the study was presented as a plenary presentation at ASCO, partly the reason it got published just this week in New England Journal of Medicine, was because the patients with transplant had a significantly better progression-free survival by 22 months over the control arm, which did not have a transplant. So the study proved two things. Transplant still matters. It does work despite having a long maintenance. That's number one. And number two, compared with the French data, providing a maintenance till progression is superior to 1 year maintenance. And so two standard of care changes. Transplant still should be utilized in the right patient population. And number two, maintenance till progression is the way to go.